Hello everyone, my name is David and today I'm going to repeat this video. Let's get started. In December 2019, the Chinese authorities notified the world that virus was spreading through their communities. During the months, it spread to other countries, a case with doubling within days. This virus is severe acute respiratory syndrome related coronavirus 2. The cause is the disease called Covid-19 and everyone simply calls coronavirus, which actually happens when it affects a human. And what should we do? Virus is just a hole around a genetic material, and a few proteins are usually not even a living thing. It can only make more of itself by entering a living cell. Corona may spread by a surface. Now it's uncertain how long it will survive on that. It main way to spreading it seems to droplet infection when people cough, or if you touch someone who's ill in your face, say rubbing your eyes or nose. The virus starts its journey there, then it is the way forward the stowaway deeper into the lungs. Its destination are intestine, spleen of the lungs can be most dramatic effect. Just a few coronavirus can cause a quite dramatic situation. Lungs are lined with billions of epithelial cells. They are a bottle of the body-lined organs and mucosa trying to get infected. The corona connects to a specific receptor on the victim's membrane to inject its genetic material. And so, or irrelevant of what's happening, execute to a new instruction that is pretty simple: copy and reassemble. It fills up more and more copies of the original virus until it reaches a critical point where it receives its one final order, self-destruct. The self-destruct melts away, releasing no new corona particles trying to attack another cell. The numbers of infected cells grow exponentially. After 10 days, millions of body cells are infected, and billions of viruses swarm the lungs. The virus has not caused too much damage yet, but the coronavirus is going to release a real beast on you, your own immune system. Your immune system, while here to protect you, actually be pretty dangerous and needs a tight regulation. As immune cells pour into the lungs to fight virus, the corona affects some of them and creates confusion. Cells have neither eyes or ears. They communicate mostly via tiny information proteins called cytokines. Really very important. Immune reaction is caused by the coronavirus infected immune cells that overreact and yell bloody murder. In a sense, it's put the immune system into a fighting frenzy and sends way more soldiers than it should, wasting its resources and causing damage. Two kinds of cells in particular work havoc. First, neutrophils are grave killing cells, including our cells. As they arrive in the thousands, they start pumping enzymes that destroy that many threats as enemies. Other important cells as well go frenzies killer T cells, which usually order infected cells to commit controlled suicide. So confused they start ordering healthy cells to kill themselves too. More and more immune cells arrive, more damage they do, the more healthy lung tissue they kill. This might get so bad that it's called permanent irreversible damage that leads to lifelong disability. In most cases, the immune system slowly regains control. It kills the infected cells, interrupts the viruses trying to infect a new one, and cleans up the battlefield. Recovery begins. The majority of people being infected by corona will get through relatively mild symptoms. In every case, it becomes severe and critical. We don't know the percentage, but not all cases has been identified. But it's safe to say there are a lot more than the flu. The most severe case is of epithelial cells that die with them, and lungs protective lining is gone, which means that alveoli, the tiny sacs of air by a breathing occurs, and infected by bacteria usually isn't a big problem. Patient pneumonia, a restriction of heart and even cells. Patient need ventilators to survive. The immune system has fought a full capacity for millions of antiviral weapons, as thousands of bacteria rapidly mutating. It's overwhelmed and enters the blood and overrun the body just as very lightly. Coronavirus is compared to the flu, but actually it's much more dangerous. We should examine death rate has been down during an ongoing pandemic. We know for sure that's much more contagious and spread faster than the flu. And two features for a pandemic like corona, fast and slow. Which feature we see depends on how we all react in the early days of the outbreak. Fast pandemic will be horrible and cost many lives. Slow pandemic will be remembered by the history of the books. Worst case scenario, the fast pandemic begins with a very rapid rate of infection. Is there no countermeasure to slow it down? Why is it so bad? In fast pandemic, many people get sick at the same time. If the numbers get too large, healthcare system become unable to care about it. There are enough resources like medical staff or equipment, ventilators left, so people die untreated. As more healthcare workers get sick themselves, the capacity of healthcare system fails even further. This becomes case horrible decision will have to make who gets to live and who doesn't. The number of deaths rises significantly during this scenario. In the world, means all of us need to do to survive and solve the pandemic. Pandemic is slowed down by right responses, especially in the early phases, so when sick get treatment and there's no crunch points overwhelmed by hospitals. Since we don't have a vaccine for corona, we have to socially engineer our behavior. Actually, social vaccine means two things. Not getting infected, two, not infected either. Although it sounds trivial, the best thing you do is wash your hands. Soap is actually a very powerful tool. The coronavirus inhales is basically a layer fact. Soap breaks it apart and be able to infect you. It also makes your hands slippery, and with the mechanical motions washing, viruses are wiped away. To properly do it, put your hands after you cut off some needles or want to put it in the contact lenses next. The next thing is social distancing, which is not a nice experience, but it's a nice thing to do. This means no hugging, no handshakes. If you can stay at home to protect those out for socially to function. The doctors, to cashier, police officers, you all depend on them. They depend on you not getting sick. On larger scales, there are quarantines, which means different things from travel restrictions to usually orders to stay at home. Quarantines are not a great experience and certainly not popular, but they buy us, especially researchers working on medication and vaccination, crucial time. And if you're under quarantine, you can understand why and respect it. None of this is fun, but the big picture is a small price to play. The question how pandemics end depend on how they start. They start fast and steep slope, and they end badly. And they start slow, not so steep slope, they can end okayish. In this day and age, it's all in our hands, literally and figuratively. So that's the end of the video. Thank you for listening. Goodbye.